same great staff, and it's really been great being here. I practiced in Manchester for 25 years, Manchester, New Hampshire, and then took a little break from practice and realized I really loved practicing medicine, and came back at the beginning of March and have had a great time in Haverhill. So I think every good talk begins with a story, and my story starts 2,500 years ago. And a lot of what goes on in medicine today is a move from sort of putting rubber bands on problems to helping anticipate and prevent problems in the future. And this concept is actually very, very old. It started with Hippocrates, the father of medicine, about 500 BC, 450, 500 BC, who believed that, in the power of prevention. And somehow we all lost our way. And when you folks were younger, and when I started practicing and got some patients from some older practicing docs, you went to the doctor when you were sick. The idea of getting something preventative was probably quite foreign, or really wasn't part of what doctors did. In fact, it wasn't until about 1968 when people started thinking in these terms, and then there was a major study in the 70s that started looking at it. And I think some of that developed from perhaps the Framingham study, which you may have heard of right here in Framingham, Mass. What they did in the 40s is they just looked at everyone in the town, I don't know, maybe not everyone, but lots and lots, tens of thousands of people, and they just started measuring things, their height, their weight, their blood pressure, their cholesterol, their blood sugar, and then they looked at how long they lived and what kind of illnesses they got. And from that is how we figured out a lot of the stuff that is sort of like, part of like, it's like breathing, high blood pressure is bad. Well, I'm not sure everyone knew that back then. Or high blood pressure caused strokes, and if you brought blood pressure down, you could help prevent strokes. There was a very big study in the 50s that proved that. It only had like 150 people in it. And they looked at a group that had very high blood pressure, and they took half and they treated with some of the blood pressure medicines. And they just saw, and the other half they didn't, which was the standard of care then. And they looked and saw what happened. About 20% of the people who weren't treated had strokes. And I think like less than 1% of people who were treated didn't have strokes. So it's huge, it's absolutely huge. So when I started my practice and I got patients from older docs, their entire medical history was on 3x5 cards. And you probably remember that, Sore throat, penicillin. That was the visit. Now you go to the doctor, what do they spend all their time doing? I didn't start practice that way. I started with a bunch of paper. And the best thing, I learned a lot of things from my dad, and he told me a lot of great things, but one of the most important things he told me that would bear fruit, 50 years later was, he said, take typing in high school. So I took typing in high school. Little did I know that I would spend my entire day in my professional career typing. And so I can actually type pretty well, but not as well as one would want. So there was this whole move that started about 1968, 1970 to start looking at prevention of illnesses. And now it's come full swing with the Affordable Care Act, or Obamacare. That's a good word or a bad word, depending on your political leaning. And I'm not going to mention where mine is, because nobody cares. But a lot of good things came of Obamacare, no matter what side of the political spectrum you're on. And some great things are that, kids could stay on their parents' insurance until 26, age 26. Physical exams were covered for folks. And what really came about that was helpful for folks who were of Medicare age is some of the things called like the annual wellness visit, which is what I'm going to focus on a little bit today. And how many of you have heard of an annual wellness visit from your doctor? You? 1, 2, 3. Annual wellness visits. So what this is, it's basically a conversation with either your doctor or a medical assistant or a nurse practitioner about some of the things that are major constituents of health. And if you think about it, health isn't when you go to the doctor. That's less than 5% of health. health is what you do every day. It's what you eat, if you get some exercise, if you drink and don't drink too much, if you smoke and decide to quit. All those things contribute to health, whereas the traditional focus of medicine has been on illness and sort of patching up things when they get bad. So that's why your doctor, well, he or she probably sometimes nags, shouldn't be nagging, but sometimes suggests, sometimes cajoles, that you give up smoking, that you try to get a little exercise, that you try to watch your diet, that you try to lose a little weight if you're overweight. So those are the things that do more than all the medicines that are out there. Diabetes. Diabetes it's rampant. About 16%. 1 in 6 people have diabetes. And that's supposed to go up to about 1 in 5 in the next 20 years or so. That's crazy. Little kids, diabetes. When I was a kid, now it sounds like that. When I was a boy, like Jay Leno used to say, I used to walk uphill both ways to school, we ate dirt. But I actually did walk uphill both ways to school because it was a big hill like this, so it was uphill both ways. And I lived just under 1 mile from school. And the limit where you could take the bus was 1 mile. So we walked a mile to school, and then we had lunchtime, and there was no cafeteria, so we walked back home, and then we walked back to school, and we walked back. So before we went out even to play at recess or at the end of the day, we were walking 4 miles. Kids are busted, half a mile now, or just crazy amounts because of all kinds of things. And that's because of a lot of reasons, but it was just, things were different. So kids got exercise even without knowing they were getting exercise. So exercise is really important, and the other things I mentioned. So this annual wellness visit is just a conversation where your doctor or his affiliated professional can go through this list of things, and this is a benefit covered by Medicare. So it's a chance to have a conversation with your doctor. It is not a physical. Some doctors have resistance to it because they think, oh, that's not a physical, I'm not going to do it. But what it is it's a chance to take an inventory of what your health status is, what the kind of things are that might be a problem down the line, and to try to approach them. So if you want, I can give you a handout about what the annual wellness visit is. And it basically, I'm not going to go through it in excruciating detail. I'm going to just touch on some highlights, and then we can just chat about whatever you folks would like to chat about. And then I have another little handout later that I'll give out at the end. But so this is a chance to update a prevention plan and to promote health as opposed to patch up things that have gone bad. It's not a physical. So basically, I assume you're all on Medicare Part B, so you'd all be covered. I assume you've all been on Medicare B more than 12 months, because there's a different exam, which is a welcome to Medicare exam that folks can get, that includes a physical exam and an EKG, but you may be past the initial 12 months. So they do some really simple things, your height, weight, blood pressure, and give you a health risk assessment, which I'm actually going to give you folks a copy of so you can look at and sort of have prepared for your doctor, if you wish, when you go, because it'll make that visit go more quickly, more efficiently, and then more importantly, you can have questions for your doctor if they come up and ways to address it. Doctors want to know what's your risk of falling. If a woman is 80 years old and falls and breaks a hip, half of those women will be dead within 1 year. So a fall is a near death sentence. So that is why preventing falls is such an important thing. And that's why you hear this big push about bone health and why osteoporosis is a bad thing. But the time really to fight osteoporosis is when you're younger and to stay active. Bones grow. Bones are living tissue. Bones are not these dead things that are static. every year we replace about 15 to 20% of our skeleton. So our skeleton's continually being broken down and continually being built up. So you could arguably say that every 5 or 6 years we're an entirely new person, because we really are. So bone health is important. You know, your ability to do things at home, bathing, dressing, things that you can do out in the community, whether you can shop for yourself and do things like that. They'll talk about your ask about your medical and family history, and most of your doctors certainly should have that part. Looking at who supplies your any durable medical equipment like walkers or oxygen, things like that. And then try to create a 5-year sort of checklist of things on the horizon. So, you know, if you're under 75 and haven't had a colonoscopy, you need a colonoscopy. Or if you have had a colonoscopy, is it 3, 5, 1, 3, 5, or 10 years that you should have your next one? And then, you know, there's a bunch of tests that Medicare will cover. They'll cover things like a screen for an aortic aneurysm if you've smoked more than 20 pack years of cigarettes at some time in your life. And then they'll look at things for, you know, do you have any signs of memory issues or things that might be of rising concern to your family? Depression. I mean, we all, you know, turn on the news and see these terrible tragedies of very famous people who seem to have it all. They have lots of money, they've got young kids, and they decide to kill themselves. And certainly as you get older, your friends start to go, and your spouse might pass, and your connections to the community, your kids might live far away, and you know that can be a tough time. So certainly looking for depression, they'll ask you a couple questions that we'll see if that's something that should be on your radar and your doctor's radar. So after your first, that relates to the first one, but really the first annual wellness exam and subsequent ones are pretty similar in their content. And basically an annual wellness exam, as I said, is fully covered as part of your Medicare Part B beneficiary service. So I have a health, this is a sample health risk assessment, which I will pass out if you want, but basically it asks things like, did you exercise? How long did you exercise? Do you smoke? Do you wear your seatbelts? Have you felt any signs of anxiety or things like that? You know, what kind of emotional and social supports do you have? How are you able to get around? So really, the focus, I think the main thing that I want to drive home with today's conversation is the focus really is on preventing things down the line. I ask people say, I haven't been in for a physical in 20 years. And I say, have you changed your oil? Do you change your oil in your car? And they say, yeah, every 3,000 miles. And I'm like, well, do you see there's a little discrepancy here. I did have one guy once who says, nope, I've never changed the oil in my car. And I'm like, all right, you're good. At least you're consistent. You know, you don't change the coil in your car. Haven't seen the doctor in 20 years. I got nothing for you on that one. So really, that's kind of the outline of what I wanted to talk to, and I just wanted to see if any of you folks had any questions or anything else you wanted to talk about here. You know, people always complain they don't have enough time to sit down with their doctor, so the door's, oh, it's not locked. Okay, oh. But I'm here, you've got me for a little bit longer, and if there's something you'd like to chat about or any questions, except for very specific, you know, I've got this, you could always say, I have a friend who, but be happy to have a conversation about whatever you like.
United Healthcare keeps wanting me to have a home nurse visit. And I have 4 doctors that are constantly watching various things, primary care, blood doctor for diabetes, foot doctor, eye doctor, and they're paying these bills. Shouldn't that kind of indicate that I'm getting good care rather than have to have a home nurse visit?
Yeah, so what does kind of fall apart sometime is the coordination of care. I mean, a lot of people have a lot of doctors, but, you know, it's kind of like, you know, the old parable of the elephant and the 8 people who are blindfolded, and one's holding the trunk, and one's holding the leg, and one's holding the tail, and they really don't get the full picture of what's going on, and sometimes that happens in medicine. So these are, it's probably a care coordinator that's calling you, or something to that
They
effect?
just want, they contact both my wife and I and say, you know, a home visit from a nurse.
And what they want to do is cover probably some of the things that I'm going to give you in this handout, which is exactly the kind of thing that's covered in, you know, to see.
And it's, you know, blood pressure, blood draw. It gets done on a massively regular basis.
Do they say they want to do a blood pressure and a blood draw?
Yeah,
too?
that's the purpose of the visit.
You know, obviously, I don't know specifically what United Healthcare is doing, but that's a move amongst a lot of the large insurers. United covers, come on in.
I had him twice to the house.
Yeah. Here, of course, here. Get you a couple chairs here. Welcome.
Yeah,
Doctor stuff.
Dr. Stafford.
Doctor stuff, patient stuff.
Thank you.
So a lot of healthcare companies, health insurers are working on this because they're incentivized to do it. They're not doing it out of the goodness of their heart. They're doing it out of the incentives that the healthier the large population that they insure is, the better they do financially. So, I mean, but that's, they're in business to make money, but they're also, they have a vested interest in trying to make sure you're healthy. Because many of the people that work for large insurers, I mean, they are healthcare professionals. They're doctors and nurses, and they're not just administrators that are looking to squeeze every last dime.
You just said something about to make money, okay? You just got an email, which you get all the time, you know, you get your, from Medicaid, what they pay out. Just a question, we were talking this morning. Our primary care is our cardiologist, and then like everybody, we have foot doctor, eye doctor. But I was looking, just for the CAT scan, what was charged for the CAT scan was $1,002. What Medicare was giving them would have amounted to like about 120 something, but they paid 80% of that. And of course, we have a supplemental. Is that all, like, that's a hospital, but we've looked to see, we go next week to our primary care, and I want to ask him, is this all you get?
Yeah.
I know, I'm not being specific, I'm not asking for an opinion. I can't believe that that's all that they're getting.
So you're getting at one of the $69,000 question in healthcare, which is what is cost and what is price? And there are probably 5 different prices out there. One is the list price, so that's the price that the institution or doctor will charge. Then there's the negotiated price that an institution or a doctor will negotiate with an insurer, which is usually much less. When you were all younger and started working, you went to the doctor and they had a usual and customary price, and the insurers paid it, and that was that. And then Joseph Califano, the Secretary of Health, Education, and Welfare then, it's now HHS. But he I think he worked for, gosh, I might be mixing it up, but anyhow, they discovered that what some car companies were paying for the insurance for their workers, what they were paying in insurance was more than the cost of the steel that was going into cars. So so everyone started saying, well, I only want to pay for what I'm paying for, because the way it used to work is, you know, if you couldn't afford to see your doctor would see you, and then, you know, later when you got a job, most doctors didn't abandon their pain. They still don't, obviously, but it was like everything kind of evened out at the end. And now we have this whole layer of people who are compliance officers and regulation people and all sorts of other folks who are there to make sure that everyone's doing the right thing, but that comes at a huge cost. So when they talk about 16 or 17% of our economy being spent on healthcare, that includes all the folks who are constantly watching, You know, did Dr. Kachovos charge too much for what he did? Did he code it too high? So there are, as I was starting to say, probably five different prices out there: the list price, the negotiated price, sometimes the cash price, which will be a discounted price off of that a hospital or provider will cover. So what you're seeing is, this is the list price of the CAT scan, and then there's the price that Medicare says, this is what we pay, that's it.
That's it.
It's in the interest of the insurers to put the list price very high, because if they charge less than what someone is willing to pay, they're leaving money on the table.
It's
But
just the difference
it gets,
between it, it's hard to
absurd.
believe.
Yeah.
I'm more concerned about our doctor, and when I see what he's supposedly getting, it's like, oh my God.
It's part of why there's a shortage of primary care doctors, and because very frankly, many of the people who would have decided to go into medicine, I mean, medical training it's not for the weak. You go to high school, and then you go to a college, and you do 4 years of college, and then you go to medical school for 4 years at private schools, which are $100,000 a year or so. And then at minimum, to become an internist as I am, you do 3 years of residency where you practically live in the hospital and you literally sleep there every third or fourth night. And so I was sort of the youngest doctor in town at 28. So you're 28 before you get out of school, and you've got the average medical school debt's about $200,000 for folks. So if you're 28, you haven't made a nickel, and you have $200,000. You have a ratty old car and probably don't have a house yet. It's a pretty steep climb to get out of. It's hard to cry for doctors, because obviously we make wonderful livings. We are incredibly blessed, but it's, people who are at the beginning of that path have to think long and hard if that's where they want to go.
Yeah, I just don't feel that they're getting enough. That's, that might sound crazy, but what he does for us,
Yeah.
and I have to, I just.
Well, on camera, I'm not going to say anything like that, so.
The opposite too, other things.
Are
In
you-
hospitals,
are
you
you
get
on
an
that?
aspirin
Yeah,
might be
Yes, I mean,
$12.
I practice- so-
So
It's
it depends.
ridiculous, yeah.
They charge more for other things, they get more, it depends on the actual test.
Yeah,
Some
So,
tests they have.
Testing is compensated better than your doctor sitting down and talking to you. That's really, many studies bear that out. That's not just, me saying
All
that.
right. So you're a primary care doctor?
So primary care. So primary care, the specialties lumped under primary care are internal medicine, which is basically adult medicine. So all of your specialists that are the non-surgical specialists, like your cardiologist and your lung specialist and your kidney specialist and your rheumatologist, all those folks have to do a training in internal medicine. So that's a 3-year residency. And then they go on and do another at least 3-year training program to go on in their specialty. So cardiologists have to go an additional 3 years above what I just said. And then if they specialize in something else, it's another year or two there. So you start to do the math, and folks could be pretty old when they're out seeing their first patient that they're actually out of training for. Then there are family medicine doctors specialize in taking care of folks from basically cradle to grave. They are trained so they can deliver babies, they take care of little kids, whereas internists do not deliver babies or take care of little kids. But they also, they know a lot about a lot of different age groups and a lot of different problems. And sometimes pediatricians are grouped in as well with primary care doctors, and sometimes OBGYNs are grouped in as well. When many of you were young, you probably saw a GP. So a GP was somebody who basically went to college, to 4 years of med school, and then went to at least 1 year of residency in either family medicine or internal medicine or something like that. And you can get your full medical license actually after 1 year of your residency, and you can go out and practice. But you have to do one of those other residencies that I talked about for somebody to become board certified. So board certification means you've done all that schooling, you've done the college, the 4 years of med school, the 3 years of, at least 3 years of residency, and then you sit for this 2-day test, which, you know, you spend 6 to 12 months studying for it. And then they have a recertification, which every 10 years you have to recertify with a 1-day test, and you spend about 6 months studying for that. And because of my gray hair, I have sat for the original and then 2 follow-ups. And I don't know if I might do the 3rd. I may or may not. That's
Are you telling us you're very young and those tests have caused the gray hair?
I had gray hair since I was 16, so I just have a lot more of it.
So what's the difference between a GP and a primary care? Aren't they,
Everything I listed are primary care doctors. Primary care means they take care of your, you know, they're not specialists, basically.
right, but then you said a GP, is it just a different title?
Yeah, there really aren't many folks who are GPs now because most hospitals and most insurers require you to be board certified. So because of that, you have to do a residency, a 3-year residency. So it's,
But a primary care doctor here, if you go to Anna Jake's, they can't go into that hospital sometimes. Why can't your primary care, when you're admitted to a hospital, go?
so again, the way it used to be is when I started my practice, for example, I started in 1989, and we did everything. We had office hours, and if somebody was sick, we admitted them to the hospital, and then we took care of them while they're in the hospital, and then we discharged them from the
Right.
hospital,
They don't
and
do
we
that.
followed them when they, you know, were well again. Now, this whole breed of doctors called hospitalists emerged, and the thinking behind that was hospitalists were there to provide more concentrated care, more continuous care while you're in the hospital. Because it is hard to juggle if you have somebody very sick in the hospital and you're seeing patients in the office, then obviously you either talk to the nurse between patients or you cancel patients and run over to the hospital. And so it's a little different mechanism. So what's evolved is this 24-hour inpatient, in-hospital coverage of hospitalists who just practice in the hospital.
But the primary care or your general practitioner knows more about you. And I would think that they could talk to each other.
Well, this is, in the medical literature, there are discussions about exactly that, and sometimes when you are seen by a hospitalist, you may have several different hospitalists, because they, of course, have a life outside of the hospital, so you may see, you know, 5 different hospitalists in a 48-hour stay in the hospital. So, you know, I guess it's how things evolved.
It's frustrating.
There are benefits, there certainly are benefits to it, there certainly are disadvantages. I think the benefits are indeed somebody's there for you, you know, virtually every minute. The disadvantage is, as you noted, is the hospitalist can in no way know you as well as your primary care doctor who's may have been with you for 5, 10, 15, 20 years.
It's very frustrating.
Yeah.
When you first started, did you take care of babies?
No, I never did, because I was always internal medicine, so
Okay.
I never took care of babies. Internal medicine
Did you
doctors.
go to houses?
Did I ever? Well, I have done some host calls in my life, but it was not part of
Yeah,
what
when I was younger, the doctors used to come to my house.
Yeah, yeah.
Yeah.
They don't do that anymore.
Listen, I'm not that old, because, although there's a whole new trend now, there are doctors who will come to your house, and it's not a service covered by Medicare, and there are doctors who, for a fee, will come to your house and tend to you if you can't get out, or families, I mean, I don't know if around here there are many doctors who do that, but I'm sure there are some, and, but usually it's a fee aside from Medicare, so, I have a friend in California who does that, for example.
Really?
And, but there are some doctors that, will, make an occasional house call, I guess.
I don't know of any, really.
Yeah, there aren't many. It's also difficult because in a patient's home, it's much harder to do, but, in your office, you have your office staff to make arrangements, you have your medical assistant or nurse to help, do things, you have, you just have more stuff in your office, and it's just harder.
When I was young, I would say maybe around 9 years old, they took my tonsils out in the house.
Yeah, yeah, there are many stories about that. And the truth be told, that taking tonsils out is actually a very risky operation, and there were a lot of tonsils taken out. There's a very famous study that was done by a guy named Jack Wenberg. And Jack Wenberg, who around 1970 published an article in I think it was Scientific American. And he did a very simple study. He looked at 2 counties in Vermont, and he said, you know, per 1,000 people in this county, how many had their tonsils out? And in this county here, per 1,000, how many people had their tonsils out? And in this county, I forget the name of the 2 counties, but in this county, it was like many, you know, 10 or 100 times as many tonsils taken out in this county than this one. And the question is, why did that happen? Was it that this county there were more cases of tonsillitis? Probably not, because tonsillitis is pretty much something that people have, and the rate is probably similar to this county to this county. And it came down to you know, differences in training and differences in what the doctors learned and what indications were.
What are the tonsils for?
The tonsils are your first line of defense against infection. So they stand as pillars in the back of your throat against stuff that we breathe in or take in. That's why when, you know, they can swell up during allergy attacks, because your body, an allergy reaction is your body thinks it's under attack. But if you're under attack by infection of some sort, they swell up because your immune system, your disease fighting system is just geared up and going into full protection mode. So the tonsils, generally, probably too many tonsils were taken out in your era.
I just told them I had mine taken out when I was young. I thought,
Yeah. And then, you know, they went full swing, and then they took no tonsils out practically. And that probably wasn't the right thing, because there were kids who indeed had significant numbers of throat infections. And it came down to, like, if you have, like, I think it's 3 episodes within a year or so, then they'll take your tonsils out. But that's pretty, you know, that's a much higher standard. Just like gallbladders. You know, they used to take gallbladders out like crazy. If you had a gallstone, take out the gallbladder. And many people have gallstones and never have a gallbladder attack. So again, you know, through time, I think that's a great question, because it kind of serves as what do we do in medicine? We're constantly looking at what is it we did before, what made sense, what population got better, what population didn't, and did it make a difference? Just because you do a test doesn't mean the patient's going to get better. Just because you do an intervention doesn't necessarily mean you're going to get better. People always like to look at, do you ever look at those, there's a million ads out there for stuff that is not FDA approved, and at the bottom it says, this product is not designed to diagnose, treat, cure, or prevent anything, right? So why do you take it? I could start stuff in my backyard and say, you know, Dr. K's poultice, and there's $13 billion a year being spent on stuff like that.
It's like, why do so many kids today have a peanut allergy? When I was growing up and telling them,
You don't play dirt.
nobody ever had a peanut allergy.
You don't play dirt.
There's not enough, I have a friend whose father was a GP, and she said, you eat a peck of dirt before you die, or something like that.
Yes, I heard that.
And the truth is, they used to, this is very up to date in the last few years, parents try to keep peanuts away from their kids. And that's why peanut allergies emerge, because when the immune system's very young, it gets used to stuff. It's not very developed, so, you know, stuff is around, and it sort of will say, you know, whatever. There are some protocols now where, and I'm not a pediatrician, so I don't know the exact protocol, but where they will slowly sort of, they want kids to be around peanuts when they're young. Went to a daycare, and the lady who ran it said, This is not a peanut-free zone, so if your kid's peanut allergic, don't bring them here. Which, you know, is,
You on a plane, and they'll let you know if a peanut allergy, 5 seats in each direction.
yeah, I think that's why they go to pretzels now.
They won't give it.
Yeah, done with peanuts. So,
Why don't they give children honey?
for what?
Children aren't supposed to have honey for the first 2 years. Have you ever heard that?
I'm not a pediatrician, so I don't know. When my kid was sick, I'd say to my wife, bring her to the pediatrician, I don't know.
We're grandparents, we're hearing all this stuff for the first time.
Yeah.
So one thing important for grandparents, though, if you haven't had, your doctor will ask you about a tetanus shot.
Yes.
So, how many of you had a tetanus shot in the last 5 years? How many of you have grandkids and got a tetanus shot in the last 5 years?
No, we just got the last ones, yeah.
I only did because I fell and they made me have one.
And did they ask if you had grandkids?
No.
No. Well, if you're a grandparent, they want to give you, there's the standard tetanus, which is tetanus and diphtheria, but they've discovered that a lot of kids were getting whooping cough because the vaccine that we all probably got when we were younger had the pertussis, the whooping cough vaccine in it, and with time, the immunity to that has worn off. So if somebody has grandkids, the tetanus shot they'll give you will have the pertussis vaccine in it to help prevent whooping cough. So.
What do you think about vitamins? Should we be taking them?
You know, if you eat a pretty reasonable diet, vitamins are, you know, what is a vitamin, first of all? What's the definition of vitamin? A vitamin is something that our body needs that's essential for life that we can't make, with maybe the exception of vitamin D, which we can get from the sun. Our skin can make it, but the truth be that up here in New England, we're probably further north, and if this spring was any measure, not enough sunny days to make much vitamin D. So that's why your doctor may, depending on their philosophy, check your vitamin D level and decide whether you need vitamin D supplementation. Most other vitamins, it's pretty rare to have a vitamin deficiency. Vitamins have been ascribed with all sorts of benefits, and some are good and some are bad. So there's a class of vitamins that mop up what are called free radicals. They mop up things that are thought to cause cancer. So they did a study. They did a big study about 15 years ago where they said, all right, they took all these former smokers and they said, all right, we're going to look at giving high doses of vitamins that mop up free radicals to them. And we're going to look and see what their cancer rate is. And we're going to give a sugar pill to the other group of people with the same characteristic. So you'd think by giving vitamins that mopped up free radicals that, you know, are things that are likely to cause cancer, in that group you'd see a lower rate of cancer, right? And these are thousands and thousands of people. You know what the study showed? It showed that the group that got the vitamins had more lung cancers than the group that didn't get the vitamins. So just because you think something's a good idea doesn't mean it actually is. So that's why we don't, you know, give things like beta carotene to
Feel
folks.
about foreigners coming over, you know, do you think they should get their shots? When I went overseas, they gave me 5 shots.
Yeah, I think there are some, I'm not up on what the testing protocols are. I mean, certainly in the United States, we were down to about 50,000 cases of TB, which was a very small number, a decade and a half or so ago. But, you know, TB's all around the world, and there are requirements that a lot of folks, if you come from certain areas, get TB tested. You know, there are certain public health things that are out there depending on where somebody comes from. Just like if you travel to a country, if you travel overseas, there's a great website that the government has. It's called cdc.gov, and if you're going to travel somewhere, it'll tell you all the vaccines you should have, and what you should, you know, if you go to Africa, what malaria prophylaxis you should have. If you go to Central America, so it's very helpful. But
Do you know anything about the black seed oil, and if it's beneficial to taking it?
I don't. You can ask me about all those kind of things. If there's not a published study for it, then I probably don't know about it.
other than tetanus as adults, are there other shots, boosters that we should have?
That's a great question, and that's one of the things that will be covered in your annual wellness visit, actually.
Yes,
So,
tell me, yeah.
in the annual wellness visit.
Oh, all right.
So it is very important to get a flu shot every fall. The reason is, it's usually the very young and the elderly who die from influenza. And there's about 30,000 lives every year saved because of this widespread influenza vaccine program that we do. The thing that was remarkable about the great pandemic of 1918, and you remember swine flu when Jerry Ford was president and all that, and they worried about it, and they were worried because it was kind of close in structure to the swine flu of 1918. That was a particularly worrisome flu because it affected mostly people of working age. So, you know, they tried very hard. I think the swine flu thing didn't work out so well, and it was kind of a political disaster too. But I was only a teenager, so medically I don't have much advice. It's a historical perspective I'm giving you on that one, but certainly the influenza shot is very important. The other two shots that are very important are, there's 2 pneumonia shots now. There used to be just one, which is called Pneumovax, and that protected against 23 different strains of pneumococcal pneumonia. And pneumococcal pneumonia is a very specific kind of pneumonia caused by the pneumococcal bacterium. As it turns out, though, they're crafty little devils, those pneumococcus bacteria, because they're covered. They have like a coating that our immune system really can't see that well. So they came out with another vaccine called Prevnar, which your doctor may have also talked to you about. And that one only hits 13 strains, but is much better at gearing up the immune system so that it can effectively fight pneumococcal pneumonia. Even though we have great antibiotics now, pneumococcal pneumonia is very hard to fight, actually. So it's good that we have a vaccine for it. So if your doctor suggests those 2 vaccines, even if you've had one of them, you should definitely get the other one too. There's now a shingles vaccine, which, you know, 80% of us have had chicken pox when we were kids, or probably 95 actually, I think.
Yes. If you had chicken pox, will you get shingles?
What's that?
Would you get the shingles if you had chicken pox?
So this is the deal. We all had chicken pox, I would bet. Serious money that everyone but one of us in this room had chicken pox as a kid. And even if you didn't think you had it, you might have had one spot somewhere you didn't notice, and your kid, brother, or sister had it, you had it too.
Yes.
So you're exposed to it. And what happens is you get better from it when you're a kid. But that virus finds a place to hang out in your body your entire life. And when you're under stress, whether it's physical stress or emotional stress, or you know, you're going to have chemotherapy, or God forbid chemotherapy or something like that, that's when that virus, it lays in wait, and when you're weak, it'll pop out. And I'm sure you've all seen, you personally or your friends have had a rash, first a little tingling, and then maybe a burning, and then a rash, and then if it's on your head, it can be very dangerous because it can cause blindness. And then after it's cured, or after it's done, it can be very, very painful in that spot, even the rest of your life. So they've developed a vaccine. There's actually 2 vaccines now for shingles prevention. And even if you've already had shingles in your life, you still can get the vaccine. The first vaccine was indicated down to age 60. The latest vaccine, called Shingrix, is probably the preferable one because it has better coverage in terms of being much more effective. It'll cover more people, and it doesn't have to be frozen. It's, you know, you get it at your drugstore. They'll give it to you, or your primary care doctor will give it to you.
How effective is it?
I think it's over 80%. I mean, it's pretty effective in preventing it. And I think 1 in 3 people will end up with shingles. So.
Now, is it just the opposite? If you never had shingles, that means you wouldn't get, I mean, if you never had chickenpox, then you probably won't get shingles.
If you absolutely for sure did not have it, then you won't get it, right?
I never had it.
Yeah, I thought I never had it either. when I was a kid.
You had shingles?
You don't remember?
Never thought I had it either until I had a young daughter. She had, oh God, she had chickenpox. It was miserable. I had patients that I saw with chickenpox, and I never got chickenpox because I knew I had been exposed to it. And then one day I woke up and my wife said, did you fall out of bed? And I had like this black smudge across my eye right here, top of my eye. And I thought about it, I said, you know what, that is shingles. So there is a treatment, this Valtrex is antivirals, and I took large doses of that and prevented it from spreading. But you know, most people aren't as lucky to make the diagnosis within an hour or two of appearance. And no, she didn't beat me. No, I didn't fall out of bed. It was,
Right.
and I went to the druggist and I said, you know, I need some Valtrex, and he's like, that's not shingles. And I'm like, shingles. And it was shingles.
My brother's 2.5 years older than me, and he has the shingles.
So my story being, even if you think you didn't have shingles, you might have had like a very low subclinical case, very, you know, a dot or two. I mean the chickenpox when you were a kid.
Now, if you had the shingles vaccine, should you have the second one?
I believe so. Yes, that it's more effective, and that's why, for folks, I've been holding off in giving the older one, because if you get the newer one, you don't need the older one,
It's awful painful too, from what I understand.
the vaccine. The shingles. Oh yeah, shingles. Oh yes, terribly so. So, and what other vaccines? Let's see. There's a vaccine for hepatitis B now, which
Yeah, what's it been talking about, a while about the,
Hep C.
hepatitis.
yeah. So Hep C. So there's hepatitis A, which is the kind people would get from, you know, bad food handling, bad shellfish, that kind of thing. Hepatitis B is typically bloodborne or sexually transmitted, and kids now are immunized against hepatitis B. When I started medical school, the vaccine had just come out, and I took the vaccine. Now it's a very safe vaccine that's made. It's made in the laboratory. They used to harvest the hepatitis B vaccine, the essential part of it, from antibodies from actual blood, and then they'd triple kill it. It was kind of a risky thing, but now it's perfectly, the vaccine is made in the laboratory. There's no blood near it at all, and it's a 3-shot series, and most people will get very good protection from it. Hep C is a worry for folks like, I think it's 20 to 65 is the age group where we routinely screen. The recommendation is to routinely screen once in somebody's life for hepatitis C. And the benefit is now hepatitis C is very treatable. The problem with Hep C is people can develop liver failure requiring transplantation or liver cancers, so that's why we very aggressively try to treat hepatitis C.
So why did they want to test people that were born like before 1945?
For what?
Hep C? Did they advertise that? Oh.
You know,
I thought it was because you were exposed to drugs maybe back in that era.
Yeah, I have to double check it. It's one of those things I should have at the tip of my tongue, but I don't. It's generally 20 to, I think it's 20 to 65, but I'd look at, if you were a patient of mine, I'd sneak out, look it up, and I'd tell you. I can't get away with that right now, but.
What's the difference between these shots? Some of them are live, like the flu, you can have a live virus and a not a live. If you have someone in your family who's in chemo, you can't have live viruses, right?
Yeah.
So do all these, is there a choice of how you can have some of these things?
It's just how they make them and how they develop them.
But when measles is a live virus and the flu shot sometimes is a live virus,
Sometimes
you
it's,
can't have those if you have.
Yeah, because their immune system is suppressed, so they could easily get it from the, or get a strain of it. So many of these have some of the same outside characteristics of the actual virus, but not the more disease-forming components of the virus.
But the shingle shot's a live virus, right?
I actually don't recall. the thing about, every year the CDC publishes a brand new chart. There's a big chart, and whenever there's a question, we just look at it. There's, 50 vaccines up there.
Yeah.
Depending on what you've been exposed to and what your health history is, so we consult that frequently to see should you get it or not.
What about these things advertising on television that, gotta take care of like psoriasis and stuff like that? And then the fine print underneath says all the other things that can happen to you if you try this, including death,
And who would take those things?
Well, that's what I'm wondering,
So, with everything we do in life, there are risks and benefits, and there are some benefits that are not worth the risk, and there are other, benefits that are worth the
Read
risk.
the bottom.
So generally, the class of medicines that you are alluding to are called biologics. They're versions of things that our own body makes to fight disease, but in like big concentrated doses, bigger than what our own system would ever generate. So what some of these things are, like to fight psoriasis or arthritis. The big one is arthritis. Arthritis, that's Humira is a $6 billion drug a year in the United States. $6 billion a year spent on Humira. But it's probably worth it, because if rheumatoid arthritis is treated early enough, it can prevent all the disfiguring, I had a patient, he had terrible arthritis, terrible disfigurement, couldn't bend his fingers, had terrible nodules, and he's someone who, if he was diagnosed today, we'd send him to the rheumatologist at the very earliest stages to prevent from getting to that point. Because a lot of disease is basically your body's own immune system attacking normal tissue. So in the case of rheumatoid arthritis, your own immune system is attacking the synovium, the smooth, like a chicken bone, your chicken leg, that smooth part, that's that part, that's what the immune system will attack in rheumatoid arthritis, and then it becomes very, the joint becomes very disfigured. So what these drugs do is it counters the effect of the immune system, so our immune system is not really able to cause that destruction.
Do you recommend that people should get an annual wellness visit at least once a year or something like that?
Yes. Yeah, it's a chance to have a conversation and sort of summarize what's going on, and
Is that paid by Medicare?
it's 100% paid by Medicare. If you look at the last page, it says it covers 100% of it. You pay nothing.
$124 charge for blood work, but that's not covered by Medicare.
But what you should know is it is not a physical, so you don't go in there expecting your doctor to do a physical. It'll be a summary of your health status. And again, your doctor may do it, or more commonly, a physician assistant or a physician or a medical assistant.
Or what's better than to go in and get a physical?
Well, Medicare doesn't cover physicals. They don't pay for physicals, so they cover this. So your doctor may do a physical, but he's doing it under you have high blood pressure and you have diabetes, so he'll be, doing some of the components of the physical as he or she is tending to your chronic medical conditions, which is what Medicare does cover.
You're talking about like a 1-year wellness visit, but if you have existing conditions in your primary care, I know he used to bring us in every 3 months, now he brings us in every 4, for AFib and for other things. We don't ask to see him when we're leaving. I noticed that he changed from 3 to 4 months, okay? So that, we see him like 3 times a year, even if we're not sick.
Yes.
That's,
So.
and it's covered.
But that's different. That he's following. So as I started the talk, I talked about prevention versus treating conditions. He's seeing you for follow-up of a known condition like AFib or your blood pressure, or diabetes.
Yeah.
Whereas this is more proactive, looking to what are those things that, what are the landmines hidden under the surface, just waiting to pop out, and maybe the annual wellness visit can help disclose it. So I think we're at the top of the hour, and
Thank you so much
I really appreciate being invited to chat with you.